Welcome back. Federal officials are investigating a series of illnesses potentially linked to bad Botox. Several cases similar to botulism in Illinois and Tennessee may have been caused by counterfeit injections.
Scary stuff, right? So how can you tell if your Botox is legit? Joining us to explain is Beverly Hills facial plastic surgeon Dr. Patrick Davis. Thank you so much for being here with us on a Sunday to ask these burning questions.
News you can use in this town.
Absolutely,
exactly.
Absolutely.
So tell us about this outbreak. What kind of symptoms are people experiencing?
So I found out about this about 2 or 3 days ago. The CDC is investigating alleged counterfeit Botox in areas that are in medical facilities that have been unregulated or people have not been fully licensed. 4 cases in Tennessee with 2 hospitalizations, 2 in Illinois, and they're botulism-like symptoms, so difficulty speaking, difficulty swallowing, sometimes keeping your head up is difficult, breathing issues. These are severe adverse reactions to this, and I definitely want to put everybody at ease that if you have FDA-approved Botox, this does not happen. So this is really interesting because the CDC is going to actually let physicians know, especially in the emergency departments, that this is going on. So there will be an announcement at some point, but right now it's just allegations and investigations.
And important that you're saying that if you have legitimate Botox, this will not happen. So what is the difference between legit Botox and whatever this counterfeit solution may be?
That's a great question. So Botox is basically the Kleenex. It's the name brand.
It's a brand, right?
It's been approved for FDA. It's been cleared in 2002. Botox is not the only one. There's Xeomin, there is Dysport, Daxxify, Jeuveau. These are other FDA-approved forms of this Botox, this toxin. If it's not FDA approved, it hasn't gone through that clearance, then I would assume that this is counterfeit. So for the past 20 years, we have not heard a lot of stories of botulism-like adverse reactions. Now, there are some minor reactions if you get some bruising or some pain on injection. That is part of more of a transient, expected reaction. Some of this other severe reactions are linked probably to this counterfeit and to people who are not properly trained or unregulated.
Yes, because I think it's become so popular, right?
Yes, this industry is very large, it's actually getting bigger, so you're going to find more and more people that, just because you are licensed, for example, I'm licensed as a physician or a registered nurse, doesn't mean you're necessarily trained in aesthetics. And I teach across the country to physicians that actually are well trained in their particular field, but I teach them, okay, this is how you properly inject, because they need that training. And when you go to these places, it's important to say, what kind of training have you had? I know you're licensed, but what kind of training have you had?
So ask about the training, and then how can people know if their Botox is legitimate? Should people actually ask to see the bottle, and what should they look for?
Yeah, I agree with that. So just like if you're going to a restaurant, you order a bottle of wine, that bottle is not opened in the kitchen, it's brought out to you. You actually see the label, it's decorked. So you have a right as a patient to do the exact same thing. You're actually ordering a fancy bottle of wine.
A lot more expensive in many cases.
In your body.
And it's going in your body. So you ask them, okay, this is the plan, can you please bring it out to me? And you take a look at it. I've had patients ask me to do this, because just because someone mixes their Botox in another room doesn't mean it's bad, because sometimes it can be efficient to do that, but if someone asks me that, I love it. And if
you're not offended.
No, exactly, and you shouldn't feel that you can't ask that question, because I enjoy it. And if somebody's prickly about that, that's probably a red flag. So you can actually see the Botox, see the vial, and you can take it one step further and say, would you mind drawing up from that vial?
And then what are you supposed to see?
Decorking the wine bottle, huh?
What do you want to see when they do that?
I just want to make sure, there are a lot of things. So I can see, are they wearing gloves? Are they cleansing the area with alcohol, your face with alcohol? And I just want to make sure that what they're drawing up is exactly coming from that specific vial or that bottle.
And then going into your body. It's the same sort of thing. How do you know, how can you detect if they are injecting it the right way?
That is difficult. That comes from just going to a trusted place. So you call ahead of time, make sure, okay, what are the credentials, what's the training from this particular area, and if they have great reviews, they've had a lot of reviews, they've been around for a while, that's when you have to have a trust and a relationship with your provider.
Real quickly, these people with these botulism-like symptoms, will they recover?
More than likely, yes. So especially when the CDC releases this to, like my sister is an emergency physician in Indiana, she'll probably receive this, so she'll know how to treat it. There's like antitoxin that people inject to stem some of this. And the good news is most of this is transient in nature.
Great news and great tips. Thank you so much.
Yes, thanks for being here. Thank you.
For more from Dr. Davis, find him at Davis Facial Plastics in Beverly Hills and at davisfacialplastics.com.
All right.
We'll see you guys after the break. Thank you.